Hi, I'm Alex Labach from Layer 6 AI. This presentation is on our paper, DuETT, Dual Event Time Transformer for Electronic Health Records. Our goal in this work was to take the startling effectiveness that self-supervised transformers have had in other areas of machine learning and bring that to hospital EHR data, specifically multivariate time series data containing lab tests and other charted measurements and events over time. This data has some challenging characteristics. Measured values are sparse and show up at irregular points in time, and many different types of values can be recorded, with complex, meaningful relationships between different types of events. Our main innovation is a transformer-based architecture that exploits both structured dimensions of this data. Whereas previous works have focused on the time dimension, we apply attention over both the time dimension and the event type dimension, allowing our model to capture complex semantic relationships in both dimensions. I'll go over this architecture. We first transform inputs into a 3D tensor with time, event type, and embedding dimensions. Our input contains event values as well as the number of measurements within a time period to capture clinical information in the data sparsity structure. Each DuETT layer takes in an input of this shape and produces an output with the same shape. Within each DuETT layer, there is an event transformer block that attends across the event type dimension and then runs a feed-forward network on each event slice, followed by a time transformer block that attends across the time dimension and then runs a feed-forward network on each time slice. This structure uses the capability of transformers to capture complex semantic relationships across sequences, extending it to both structured dimensions. We also propose a self-supervised learning method that exploits both dimensions. We mask entire slices across the time and event dimensions and train the model to reconstruct both the masked values as well as the sparsity structure of the data. We evaluate our model over multiple tasks on the Mimic4 and PhysioNet 2012 EHR datasets, showing that it outperforms state-of-the-art methods. Notably, we show that previous deep learning methods did not outperform a well-tuned XGBoost model, but our model does. We also show that our self-supervised learning scheme is highly effective for producing patient representations. Our model can outperform most previous methods by just training a linear layer on these representations. It can also maintain high performance when a high percentage of its input data does not have labels available. These capabilities show the clinical potential of training a foundational DuETT model and then easily adapting it for various downstream tasks. We hope this work demonstrates the potential of self-supervised transformer models in this area and the importance of explicitly modeling relationships between clinical events. We're currently working with Canadian Hospital to evaluate practical deployments of DuETT, so we're also excited about the potential clinical impact of this work. Thank you.